Hi, I'm Andrew Grecki, physical therapist at Superior Physical Therapy, and we are the hip pain specialists. I'm here today to help you shed some light on where your hip pain is coming from. There are many causes of hip pain in the body and many tests to determine where that pain might be coming from. Today I'm going to show you a very quick 30-second self-test to help you understand where your hip pain might be coming from, and then it's up to you to ask for help. Hopefully you enjoy our test.
Before I show you the 30-second self-test for hip pain, I just wanted to go over some of the common causes of hip pain or conditions that we see in physical therapy. By far, one of the most common issues that we see with patients is what's called hip bursitis. And typically that is pain on the lateral aspect of the hip that is painful to the touch or when you lay on that side. On the left image here you can see these little bluish kind of white circles here on the greater trochanter, which is a bursa. A bursa is a fluid-filled sac that it's natural to have, but when that fluid-filled sac gets inflamed and irritated, that can cause pain. On the right side here, you can see the common places to have bursitis. The biggest circle on the outside is the lateral trochanteric bursitis, the most common. The front of the hips can have bursitis as well as the inside. Second most common condition in this image just shows the location, which is in the front of the hips. This would be the hip flexor pain or tendonitis. And in the back of the hips here, you can see inflammation of the SI joint. The SI stands for sacroiliac, so that is technically a hip condition, but oftentimes can be confused with lower back pain as well. These are the three most common issues we see with hip pain, and enjoy our 30-second self-test.
We're here to show you the 30-second self-test for hip pain. There are many tests that we can do to determine the source of your hip pain, but what we've decided today, my wife Erin here is going to be our patient or our model. We're going to show you what the hips should be able to do, and it's up to you at home to determine whether or not the motion was painful or limited. And if painful or limited, then the idea is that physical therapy can restore your motion and help you with your hip pain. So the first thing we're going to do is assess the left hip on Erin. And I want you, Erin, to simply take a big right step forward and then back. Okay, and I want you to try that 3 times. And what we're looking for here is how well Erin's left hip goes into extension. Okay, now take that right foot and I want you to step backwards and kind of lean forward like this and try that 3 times. Now we're assessing how well Erin's left hip goes into flexion or bending forward. Okay, now take your right foot and I want you to step over to the right side and shift your weight. Good. In this test here, we're looking at Erin's left hip's ability to move into what's called abduction. Very commonly can be sore and limited if tight. Now take that right foot and cross over to the left. Try that 3 times. This is assessing Erin's ability to have her left hip go through what's called adduction. Very common for people that have hip bursitis or pain with that movement. Now there's 2 more. You're going to take your right foot and rotate to the right 3 times. That's looking at the left hip's ability to rotate outward. And then finally we're going to take that right foot and go across the body like so. This looks at the hip's ability on the left side to turn inward, very commonly limited in motion. Now let's go through that sequence on the other side. So you're going to take a left step forward. Good. Looking at the right hip. Good. Now take that left foot straight back. Good. Now take that left foot to the left side. Good. Good. Now take it to the right side. Now rotate back to the left. Good. Now finally rotate over to the right. Good job. Okay, now the test really is, were any of those movements painful or limited in motion? If so, physical therapy can fix that for you without medications, without surgeries, and without injections. Thanks, Erin. Well, now that you've performed your 30-second self-test for hip pain, hopefully you understand better where your hip pain is coming from, and you're ready to take the next step. If you're ready to schedule an appointment with a hip pain specialist here at Superior Physical Therapy, our number is 944-6541, and we guarantee we'll get you in within 24 hours. If you're not ready to take that next step, we understand. That's why we've created resources on our website that include things like the top 3 exercises for hip pain. Now keep in mind, those are for the most common reasons that people have hip pain, but there are many causes to having hip pain, and that's why it's important to get seen by a hip pain specialist here at Superior Physical Therapy. We hope you enjoyed our video, and we hope you find a permanent solution to your hip pain.